So today we'll be discussing Betsy. She's our patient who's 69 years old, overweight, and had a mini stroke. Betsy wants to prevent a future cardiovascular event from happening. First, we'll discuss some of her blood panels and the levels that she has.
After performing our blood panel, our patient has shown high LDL, low HDL, and high VLDL. With our patient having those scores, we need to take in consideration that she is having plaque buildup in the walls of the blood vessels. With our patient having the cholesterol levels, she is susceptible to having another stroke and also has a positive risk factor for cardiovascular disease. Fibrinogen is a plasma protein in the liver involved in blood clotting. Having a high fibrinogen makes the blood more viscous, which interferes with the blood flow, increases the workload of the heart, and promotes excessive platelet clumping. This consideration should be taken in when exercise comes into play. We also want to monitor her workload of the heart to prevent her from having another stroke.
Homocysteine is the next one. Our patient presents a high-level classification of homocysteine. This is an amino acid that is formed from methionine breakdown. Homocysteine is usually converted into cysteine or methionine, but some people lack that enzyme to convert it. High levels will damage arteries, promote cholesterol buildup, and interfere with clotting factors. If homocysteine levels are decreased in patients with the enzyme deficiency, this will decrease the cardiovascular disease risk. Next is C-reactive protein. Our patient also presents levels of C-reactive protein that are above standard lab ranges. This is made in the liver and indicates inflammation. There are different causes of inflammation in the body that would cause C-reactive protein to rise. These include coronary artery disease, cancer, infection, or trauma. C-reactive protein levels predict one's risk for a heart attack. Lastly, we have blood pressure. Our patient presents stage 1 hypertension. It's important to work on leveling out this blood pressure due to the increased risk of another stroke occurring. Blood pressure could be elevated due to psychological stress or pain.
So the first thing that we want to address in terms of the patient's care is her high blood pressure. Hypertension causes oxidative stress on the body, which leads to endothelial dysfunction and therefore an increased risk of stroke. She is also at an increased stroke risk due to her being overweight. We would like her blood pressure to drop to at least 120/80, but 115/75 would be preferred. In addition to addressing her blood pressure, a weight loss component of her program would be beneficial. The patient also has high homocysteine, as already mentioned, which can be very harmful on her body as it damages the arteries, promotes cholesterol buildup, and interferes with clotting factors. This can be very detrimental and increases her risk of having a stroke because clots are more likely to build up and can cause an occlusion of the artery. Our aim is to lower her level to at least 15, which is classified as normal. Lastly, the patient's high fibrinogen levels need to be addressed. Because fibrinogen interferes with blood flow, increases the workload of the heart, and promotes excessive platelet clumping, her risk of another stroke is elevated. Our aim is to lower our client's fibrinogen level to at least 4.
Previously, our client was on a Western diet which consisted of red meat, processed and prepackaged foods, and foods that were high in sugar. She should eat whole foods and lots of vegetables. She can eat snacks like seeds and nuts and should avoid sugar. One of the most important macronutrients that she should have is protein, and it's important for wound healing and supporting immune functions. She should take supplements with B6, folic acid, and B12 to help lower her homocysteine. One of the macronutrients that has a lot of protein, vitamins, and minerals are legumes. Foods that help with overall blood pressure and cholesterol should be accounted for, and if she is unable to eat after having her stroke, smoothies that are high in vegetables and low sugar fruits are good.
Exercise helps lower high blood pressure, which is an important risk factor for stroke. Exercise can help you control other things that put you at risk, such as obesity and high cholesterol. Exercise at a moderate intensity for at least 5 days a week, while increasing intensity over time is the main goal, and then to increase the patient's duration. Another goal for the patient to improve through exercise is their gait patterns. And to prevent another stroke from occurring, we want to improve their overall function so that their recovery phase is strong.
One exercise that we thought we could incorporate for this patient would be brisk walking, and you could do this on a treadmill or just walking around the neighborhood. And we wanted to keep the patient between 40 to 70% heart rate reserve and do this for around 15 to 30 minutes and up to 5 days a week. And if stumbling or falling is a risk for the patient, a supported treadmill walk could also be utilized. And also slow speed or using a self-selected pace and slowly increasing in grade or using a harness could also be utilized.
We also want to incorporate some resistance training, keeping them at about a 50 to 70% of their 1 rep max. If tolerable, they can also go up to 80%. This activity would be about 30 to 45 minutes, keeping it 1 to 3 sets and 8 to 15 repetitions of each exercise. And we want them to do this at least 2 days a week, performed on non-consecutive days. Some bodyweight exercises, we would do bodyweight squats, lunges, arm circles, calf raises, and chair sit to stands, as well as including some resistance bands, such as performing seated bicep curls, seated single arm lateral raises, and seated shoulder internal and external rotation.
And the last thing that we wanted to incorporate was flexibility. And this could be done 2 to 3 days a week and hold the stretch for around 10 to 30 seconds and can be performed before or after aerobic or strength training sessions. And some of these stretches could be passive stretching, and that's when you're relaxed and there's no contribution to the range of motion. It's just like an outside agent would be creating the force, like a band, towel, or person. And some of these stretches could be ankle stretches, hamstring stretches, and chest opener stretch. Also, Pilates and yoga could also be good utilization.